If you've ever woken up in the middle of the night to what feels like your big toe being crushed in a vice, you already know what gout is. And if you've never experienced it, count yourself fortunate. Because gout is routinely described by people who've had it as some of the worst pain they've ever felt in their lives. Some patients say that even having a bedsheet resting on their toe during an attack is completely unbearable. The joint feels as though it's on fire, burning and swollen and red, and walking becomes almost impossible. Gout is one of the oldest recorded diseases in human history. Ancient Egyptian physicians documented it thousands of years ago. For centuries, it was called the disease of kings or the rich man's disease, a condition associated with feasting on meat, shellfish, and wine. The great irony is that today, gout has become more common than ever, and it affects people of every income level. Over 9 million adults in the United States are currently living with it, and that number has been rising steadily alongside shifts in the modern diet. So, what exactly is going on inside your body when gout strikes? Your body naturally produces a substance called uric acid as a byproduct of breaking down compounds called purines. Purines are found in every living cell, both inside your own body and in many of the foods you eat. Under normal circumstances, uric acid dissolves in your blood, travels to the kidneys, and leaves your body through urine. The problem happens when your body either produces too much uric acid or your kidneys are not clearing it efficiently enough. When uric acid builds up past a certain threshold, it can no longer stay dissolved. Instead, it crystallizes, forming tiny, needle-sharp structures called monosodium urate crystals. Those crystals accumulate in and around your joints, and when your immune system detects them, it launches an inflammatory response. That response is the gout attack, the sudden, savage pain and swelling that can strike without warning. The joints most commonly targeted are the big toe, the ankle, the knee, and the wrist. In severe long-term cases, clusters of crystals called tophiae can develop visibly under the skin and cause permanent joint damage. High uric acid levels are also strongly linked to kidney stones, and research shows that up to 4 in 10 people with gout also have some degree of kidney disease. Now, genetics play a huge role in who gets gout. Some people can eat freely and never develop it. Others seem genetically predisposed to produce too much uric acid or struggle to excrete it properly. But here is the key thing to understand. Even if you have a genetic predisposition to gout, what you eat and drink can dramatically accelerate how often you have attacks, how severe they are, and how quickly the condition progresses. Diet isn't the whole story, but it is absolutely one of the most controllable parts of it. With that in mind, let's go through the 10 worst foods for gout. The ones that research has most consistently linked to elevated uric acid levels, increased gout risk, and more frequent, more painful flare-ups. Some of these will not surprise you at all. A few of them almost certainly will. Number 1. Organ meats. We're starting here because organ meats sit at the very top of the purine content charts. We're talking about liver, kidneys, sweetbreads, which are the thymus or pancreas of a calf, lamb, or pig, as well as tripe, brains, and tongue. These are not just high in purines, they are among the highest purine foods that exist. To give you a sense of the scale here, most cuts of regular beef contain around 100 milligrams of purine per 100 grams of meat. Organ meats blow past that completely. Calf's thymus, for example, can contain over 1,200 milligrams of purine per 100 grams, more than 10 times the amount found in standard red meat. Beef liver and kidneys sit in similar territory. These tissues are metabolically dense. They are packed with cellular material, and every cell in an animal's body contains purines as part of its DNA and energy machinery. When you eat these foods and your digestive system breaks them down, it releases an enormous purine load that your body then converts into uric acid. The Mayo Clinic and virtually every major rheumatology organization recommend avoiding organ meats entirely if you have gout. This is not a limit your portions situation. It is a flat-out avoidance recommendation, particularly during and after a flare-up. What makes this relevant today is that organ meats have seen a surge in popularity in certain dietary circles, particularly among people following carnivore style or nose-to-tail eating approaches. Liver and kidneys are promoted as nutrient-dense superfoods, and in some respects they are, being rich in iron, B vitamins, and zinc. But for someone with gout or a predisposition toward high uric acid, the cost of that nutrition is far too high. The purine load from eating liver regularly can push uric acid levels to dangerous heights and trigger attacks in people who might otherwise be managing well. If you have gout and you've been eating organ meats regularly, this is the very first thing to stop doing. The improvement in uric acid levels can be significant, and removing this one food category from your diet can make a real and noticeable difference. Number 2, beer. Beer deserves its own conversation because it is uniquely damaging to people with gout, and the reasons why are actually more complicated than most people realize. Most people are vaguely aware that alcohol is bad for gout, but beer is in a category of its own, worse than wine, worse than spirits in most respects. And here is why. When you drink beer, you are getting a double hit on your uric acid levels from two completely separate mechanisms. First, beer contains purines directly. Brewer's yeast, which is used in the fermentation process, is itself extremely high in purine content. The hops used in beer also contribute. Studies have measured purine concentrations in beer at up to 1,000 micrograms per liter. Wine and distilled spirits, by contrast, contain less than 100 micrograms per liter, a tenfold difference. So even before the alcohol itself does anything, the beer is loading your system with purine compounds that get converted to uric acid. Second, all alcohol, including beer, interferes with how your kidneys handle uric acid. When alcohol is metabolized, it produces lactic acid, which competes with uric acid for the same excretion pathways in the kidneys. The result is that uric acid gets reabsorbed back into the bloodstream rather than flushed out in urine. Your kidneys are effectively blocked from doing their job. On top of that, alcohol metabolism requires a large amount of ATP, the cell's energy molecule. And when ATP breaks down rapidly, it generates purine precursors that feed directly into uric acid production. Research from a large national health survey found that each daily serving of beer raises blood uric acid levels by approximately 0.46 milligrams per deciliter. The Arthritis Foundation has noted that even non-alcoholic beer raises uric acid levels by around 4.4%, while regular beer raises them by about 6.5%. A major study looking at over 400,000 people found that beer and cider were consistently the most gout-promoting alcoholic beverages for both men and women. For people in the early stages of gout, or those trying to avoid their first attack, heavy beer drinking roughly triples their risk of developing gout compared to those who don't drink. For people who already have gout, drinking beer during or shortly before an attack can dramatically amplify the pain and extend the duration of the flare. The honest recommendation from specialists is this: if you have gout, beer should be removed from your regular diet as completely as possible. During active flare-ups, it should be avoided entirely without exception. Number 3, sugary sodas and drinks high in fructose. This one surprises a lot of people, because most discussions of gout center on meat and alcohol. But sweetened beverages, your sodas, your fruit punches, your sweetened iced teas, your energy drinks, are one of the most significant drivers of the gout epidemic of the past few decades. The culprit is fructose. Fructose is a type of sugar, and what makes it uniquely damaging in the context of gout is that it is one of the only dietary substances that can directly trigger uric acid production in the liver within minutes of being consumed. Unlike glucose, which your body burns for energy in a relatively straightforward way, fructose gets metabolized differently. It causes a rapid drop in ATP levels in your cells. When ATP breaks down, it produces AMP, which then feeds into the pathway that generates uric acid. Research has shown that uric acid levels in the blood can rise measurably just 30 to 60 minutes after someone drinks a fructose-rich beverage. High fructose corn syrup is particularly problematic. It became a dominant ingredient in soft drinks and processed foods in the United States starting in the late 1960s, and its widespread adoption tracks almost perfectly with the doubling of gout rates in the American population over the following decades. A major 2008 study found that men who drank 2 or more sugary sodas per day had an 85% higher risk of developing gout compared to men who drank less than one per month. A 2010 study following nearly 79,000 women over 22 years found that women who drank 1 can of sugary soda per day had a 74% higher gout risk than those who rarely consume such drinks. The mechanism here is separate from purines entirely. Fructose does not contain purines and is not a purine in itself. Instead, it triggers the body to produce more purines endogenously, meaning it causes your own cells to manufacture purine compounds that then get converted to uric acid. This is a fundamentally different pathway than eating a steak, but the end result is the same: more uric acid circulating in your blood, a greater chance of crystal formation, and a higher likelihood of a gout attack. Regular table sugar, which is sucrose, is roughly half fructose and carries similar concerns. Diet sodas, by contrast, have not been shown to raise uric acid levels in the same way, though they come with their own health questions. For anyone trying to manage gout, switching from regular soda to plain water, unsweetened sparkling water, or black coffee is one of the most impactful dietary changes you can make. Number 4. Red meat, beef, lamb, and pork are a cornerstone of the typical Western diet and also a well-documented contributor to elevated uric acid levels. Unlike organ meats, red meat contains moderate rather than extreme levels of purines. Most standard cuts of beef clock in around 100 milligrams of purines per 100 grams. But they are eaten in much larger quantities and far more frequently than organ meats, which is what makes them so impactful in practice. A large meta-analysis published in PubMed that pooled data from 19 studies found that high red meat consumption was associated with a 29% increase in the risk of developing gout. That might not sound as dramatic as the numbers for alcohol or fructose, but when you factor in how often red meat appears in the average person's diet, often multiple times per day, the cumulative purine exposure adds up quickly. Some cuts are worse than others. Fattier cuts, and those cooked with skin or bone, have higher purine concentrations. Ground beef, chuck, and rib cuts tend to be on the higher end. Leaner cuts like sirloin or tenderloin are somewhat better, though still not without risk. Importantly, cooking method matters less than people think. Boiling meat does leach some purines into the cooking water, but the overall purine reduction is not dramatic enough to make problem cuts safe. Pork deserves a specific mention because people sometimes assume it is safer than beef. Bacon, in particular, is both high in purines and laden with sodium and saturated fat, a combination that is particularly bad for gout management. Processed pork products like sausage and ham add further layers of risk due to their preservatives and sodium content. For people managing gout, the general guidance is to limit red meat significantly rather than eliminate it entirely, keeping servings small and infrequent. But if you are someone who is eating red meat 2 or 3 times a day, across every meal, the reduction in uric acid from pulling that back can be real and meaningful. Number 5. Shellfish. Shellfish occupy a difficult space for people with gout because so much of the dietary advice around seafood focuses on the benefits of omega-3 fatty acids, fish oil, and eating more seafood for heart health. All of that is true in a general sense, but certain shellfish are extremely high in purines and can trigger gout attacks with uncomfortable reliability. The worst offenders are scallops, mussels, oysters, and clams. These bivalves are filter feeders that accumulate a dense cellular mass within their bodies, and that cellular density translates to very high purine concentrations. Scallops, in particular, are considered one of the most problematic shellfish for gout sufferers. Lobster, crab, and shrimp occupy a somewhat more complicated position. Shrimp contains around 93 milligrams of purine per 3.5-ounce serving, which is lower than the most problematic shellfish, and some sources suggest it can be tolerated in moderation. Lobster and crab fall somewhere in the middle. However, all shellfish still represent a meaningful purine load. And for anyone in the midst of a flare, or trying to bring uric acid levels down from an elevated baseline, cutting out all shellfish entirely is the safer choice. The key distinction to understand is that shellfish and high purine fish are not equivalent to high purine vegetables. Research has consistently shown that the purines in animal-based foods, particularly shellfish and organ meats, are more readily converted to uric acid and more likely to trigger gout attacks than the purines found in plant foods like spinach, asparagus, or mushrooms. The same amount of purines from vegetables does not produce the same increase in uric acid as the same amount of purines from shellfish. The biology is different, and this matters when making food choices. Number 6. Sardines, anchovies, and high purine oily fish. Small oily fish like sardines, anchovies, mackerel, and herring are a fascinating case study in the complexity of gout management. On one hand, these fish are genuinely excellent sources of nutrition, rich in omega-3 fatty acids, calcium, vitamin D, and protein, with real and well-documented benefits for heart health, brain health, and reducing inflammation in general. On the other hand, they are among the highest purine fish you can eat, and for someone with gout, that creates a real tension. Anchovies are particularly concentrated in purines. They are small, dense, and eaten whole, and their purine levels are high enough that they were historically listed outright as a food to avoid for gout patients. Sardines are in the same category. Mackerel, herring, trout, and haddock all sit at the higher end of the purine spectrum for fish as well. The reason these fish are so high in purines is partly their size and the way they are consumed. Unlike a large fish where you eat a fillet of muscle tissue, anchovy paste and sardines include the whole fish, organs, bones, and all, which concentrates the purine load significantly. For most people with gout, the practical guidance is to avoid anchovies and sardines as regular dietary staples, particularly in large quantities. If you enjoy mackerel or herring, limiting portions and frequency is advisable. Higher purine fish that offer substantial omega-3 benefits, like salmon, can often be eaten in moderation because their purine content, while present, is lower than that of the most problematic options. One nuance worth noting, some research suggests that the benefit from omega-3s in moderating inflammation might partially offset the risk from purines in certain fish. This is why the Arthritis Foundation has softened its guidance on seafood in recent years, moving from outright avoidance to a more nuanced, moderate consumption of some fish may be acceptable position. Number 7. Hard liquor and spirits. We already covered why beer is particularly damaging for gout, but it's important to address spirits and hard liquor separately, because many people with gout have made the switch from beer to whiskey, vodka, or gin, under the impression that they've made a safe substitution. That substitution is better in some respects, and still problematic in others. Distilled spirits do not contain meaningful amounts of purines. Unlike beer, where brewer's yeast contributes a direct purine load, the distillation process eliminates virtually all the purine compounds originally present. So, if purines were the only concern, spirits would be a safer choice. But purines are not the only concern. All alcohol, regardless of type, interferes with the kidney's ability to excrete uric acid. The metabolic byproducts of alcohol consumption, particularly lactic acid, compete with uric acid for the excretion channels in the kidney's proximal tubule. This means uric acid that would otherwise be flushed out in urine gets reabsorbed back into the bloodstream instead. The more alcohol consumed, the worse this effect becomes. A study looking at the relationship between different types of alcohol and gout attacks found that consuming more than 1 to 2 drinks in a 24-hour period of any type of alcohol was associated with a significantly increased risk of a recurrent gout attack. Even moderate drinking appeared to carry elevated risk. Research published in The Lancet found that heavy drinkers had a staggering 264% higher risk of gout compared to people who rarely or never drank. Wine appears to be the least problematic alcoholic beverage for gout when it comes to uric acid. Several studies show wine does not raise serum uric acid to the same extent as beer or spirits. However, the case crossover research from Boston University found that even wine was associated with increased risk of recurrent attacks, suggesting that the alcohol itself, regardless of source, is doing harm. The most conservative but honest recommendation for anyone managing gout is this: if you are going to drink at all, treat it as an occasional indulgence rather than a daily habit. Avoid drinking entirely during any active flare. And if you are not currently on medication to lower uric acid, consider whether any alcohol at all is worth the trade-off. Number 8. Processed meats: bacon, sausage, hot dogs, and deli meats. Processed meats combine multiple gout-aggravating factors into one convenient, widely available package, which is part of what makes them so problematic. They are not just high in purines, they are also extremely high in sodium, saturated fat, and preservatives, each of which adds its own layer of risk. Bacon is one of the most frequently cited triggers for gout flares. Pork itself is moderately high in purines, but the processing of bacon, the curing, the smoking, the heavy salting, adds sodium levels that can impair kidney function over time. Salt intake is associated with higher uric acid levels and reduced kidney efficiency in excreting it. One study published in the medical journal Circulation found that people with high salt intake had measurably elevated serum uric acid and signs of early kidney damage. Sausage, pepperoni, salami, hot dogs, and deli meats present similar problems. Processed deli turkey, which people sometimes reach for as a healthier alternative, contains both the purines inherent to turkey, which we'll get to shortly, and the added sodium and preservatives of the processing. Cleveland Clinic's dietary guidance specifically warns against processed deli turkey for gout patients, even though plain turkey breast might seem like a reasonable lean protein choice. The broader issue with processed meats and gout is that they tend to be eaten frequently in large amounts as easy everyday foods. They show up at breakfast, lunch, and snack time. Someone who eats bacon with their eggs, deli meat on their sandwich, and pepperoni on their pizza has loaded their system with purines, sodium, and saturated fats multiple times before dinner. That cumulative daily intake, sustained week after week, contributes to chronically elevated uric acid levels that raise the baseline for when a flare can be triggered. For people managing gout, swapping processed meats for plant-based protein sources, eggs, or modest amounts of poultry is one of the more practical and impactful dietary changes available. Number 9. Turkey, veal, venison, and other game meats. Here is a surprise for most people. Turkey is notably high in purines for what is typically considered a lean, healthy protein. The Arthritis Foundation has specifically flagged turkey and goose as particularly high in purines among poultry, higher than chicken, which tends to be the recommended alternative. Turkey sits in a moderate to high purine range, with a 3-ounce serving containing around 120 milligrams of purines. This matters because turkey has developed a reputation as a healthier option for people watching their diet, and people managing gout sometimes pivot to turkey sandwiches, turkey burgers, and deli. Turkey thinking they are making a safe substitution. If that turkey is processed deli turkey, as previously mentioned, the picture gets worse. Even unprocessed turkey, eaten in large amounts, can push purine intake higher than expected. Game meats sit even higher on the purine scale. Venison, goose, veal, rabbit, and wild boar are all significantly higher in purines than chicken or even standard beef. This is partly because wild animals, having spent their lives moving and foraging, have denser, more metabolically active muscle tissue, and more metabolically active tissue means more purines. Historically, gout was dubbed the rich man's disease, precisely because wealthy individuals had access to these game meats, along with shellfish and fine wine. In practical terms, this means that if you're a hunter and you've been eating venison as a regular protein source, this is worth reconsidering if you have gout. If you love Thanksgiving turkey, fine, it's one meal, but turkey as an everyday protein replacement for someone with active gout is not as safe a choice as many people assume. Chicken, particularly skinless chicken breast, remains the more gout-friendly poultry option. Number 10. Gravy, meat drippings, and yeast extracts. This final entry is one that catches people completely off guard, and it deserves careful attention because these foods hide in plain sight. Gravy is made by collecting the drippings from cooked meat, the liquid that runs off roasts, chops, and poultry as they cook. Those drippings are incredibly rich in everything that was inside that meat: fat, flavor, and yes, purines. When proteins break down during cooking, purines leach out of the cells and concentrate in the cooking juices. A gravy made from beef, pork, or chicken drippings can contain a surprisingly high purine concentration, higher per serving than you might expect from a sauce. Health experts who advise gout patients specifically list gravies and meat-based sauces as foods to limit or avoid, and this is a food that slips under the radar for many people. Yeast extracts are similarly problematic and similarly overlooked. Products like Marmite and Vegemite, the dark, intensely savory spreads common in the United Kingdom and Australia, are made from concentrated brewer's yeast. Brewer's yeast is extremely high in purines, as it is a byproduct of the beer-making process and dense with nucleic acids. Consuming yeast extract in any significant amount introduces a meaningful purine load, and dietary recommendations for gout specifically call out yeast extracts as something to avoid. More broadly, this category includes any nutritional supplements that contain brewer's yeast, as well as packaged foods that use yeast extract as a flavoring agent. Yeast extract appears in many packaged soups, snack foods, crackers, and seasoning mixes, often listed in the ingredients without the average consumer recognizing it as a gout concern. Reading food labels with this in mind can reveal hidden purine sources in foods you might otherwise consider harmless. The same principle applies to concentrated meat-based soups and stocks. A rich bone broth or meat stock, depending on how it's made, can concentrate purines in a similar way to gravy. If you are actively managing gout, homemade broths and commercial stocks made from meat bones may be worth limiting as well. Understanding which foods trigger gout is valuable, but it's worth stepping back and seeing the bigger picture. Diet alone can reduce uric acid levels, but research suggests that dietary changes typically lower uric acid by around 1 milligram per deciliter at most. That is meaningful, but for many people with gout, especially those with more severe or frequent attacks, medication is also necessary. Drugs like allopurinol, which reduce uric acid production, or uricosuric agents, which help the kidneys excrete it more efficiently, are often an essential part of treatment. Diet works best as a complement to medical management, not as a replacement for it. That said, there are also foods and habits that actively help. Staying well hydrated, aiming for 6 to 8 glasses of water per day, and increasing that significantly during a flare, is one of the simplest and most effective things you can do. Water helps the kidneys clear uric acid from the blood. Low-fat dairy products have consistently shown a protective effect in research. Milk proteins appear to promote uric acid excretion and may blunt the body's inflammatory response to urate crystals. Tart cherry juice and cherry extract have shown genuine promise in multiple studies, with evidence suggesting they can lower uric acid levels and reduce the frequency of gout attacks. The antioxidants and anti-inflammatory compounds in cherries appear to interfere with the uric acid production pathway. Coffee, somewhat surprisingly, has been associated with a lower risk of gout in several large studies. It appears to inhibit the enzyme that breaks down purines into uric acid. Vitamin C has also shown some benefit in lowering uric acid levels. Most vegetables, even ones that contain purines, like spinach, asparagus, mushrooms, and cauliflower, do not appear to increase gout risk the way animal-based purines do. The purines in plant foods are handled differently by the body, and the research consistently shows that eating plenty of vegetables is safe and even beneficial for people managing gout. The overall picture is this: the worst foods for gout are primarily animal-based, heavily processed, or loaded with fructose. Avoiding organ meats, cutting back sharply on beer and alcohol, eliminating sugary drinks, moderating red meat and shellfish, steering clear of processed meats, and being wary of turkey, game meats, gravy, and yeast extracts will collectively do more to reduce your gout attacks than almost any other single change you can make outside of medication. Gout is painful, but it is also one of the most manageable forms of arthritis when people have accurate, practical information. The connection between what you eat and what happens inside your joints is direct and well established. Every time you pass on the beer, swap the deli meat for something cleaner, or reach for water instead of soda, you are reducing the amount of uric acid your body has to deal with, and reducing the chance that you'll wake up at 2 in the morning wishing you could just remove your own toe. Making those changes consistently over time is genuinely one of the most powerful tools you have. Use it.